Good morning. It is the 4th of October 2020, 11 o'clock Delhi time. I have the very good news that my first grandchild was born at 9:34 a.m. in England. The little princess is a lovely bundle of joy. And apart from that, we of course have to grapple with the news that the President of the United States is admitted at the Walter Reed Hospital in Washington with COVID-19. President Trump announced late Thursday night, in fact, Friday morning at 1 a.m. local time, that he has turned out to be positive, and the next day he was shifted to the hospital. Now, the news coming out is rather mixed. The doctor treating him, Dr. Sean Conley, has announced last evening, that is, Saturday morning, in a news conference, that the president is doing very well, that his parameters are well in normal limits. His heart, liver, and kidney are functioning normally. But the chief of staff of the White House, Mr. Meadows, has said something quite to the contrary. According to him, the president was a bit uncertain. He was having difficult times, and a lot of sources have piped up that the president was receiving oxygen while he was in the White House. The doctor, of course, when asked whether the president received oxygen, said that he is currently not on oxygen. He did not deny the fact that Donald Trump did receive oxygen earlier or not. Now, the fact remains as to where did the president acquire the virus. The likeliest source is the function on Saturday held in the White House in the Rose Garden, where the president announced his nominee for the Supreme Court, Judge Amy Barrett. And at this function, it was clearly seen that quite a few people had congregated, but there was a very little distance between one another, between these people, barely 6 inches. And the great majority of these people who had assembled did not wear a mask. The result is that the president is infected, the first lady is infected, 2 senators, Mr. Lee and Mr. Tillis, Tills or something of that name, are infected. The governor of Jersey is infected. The president of Notre Dame University is infected. 3 or 4 reporters are infected. So this was a super spreading event. Apart from these people, 2 advisors to the president have also been infected, Hope Hicks and a lady called Kellyanne Conway. So a lot of people already have been infected at this function, and this was a super spreading event, therefore, and all cautions were thrown to the wind. People were not wearing masks, and people were sitting very close to each other. So even if you are tested, as is the president of the America, multiple times in a single day and every day of the week, you can still catch this infection, which means that testing has its values but also has its limitations. You cannot prevent an infection simply by testing, because you have to follow the norms, which I have been telling repeatedly, that you must wash your hands, you must avoid crowds. In the event that you go into a crowd, do wear a mask and try to stay away from people. These are the basics in preventing this infection, and which are far more important than simply testing by a PCR test or by a rapid antigen test. It must be noted that President Trump was being tested by a rapid antigen test, which is not that sensitive as is an RT-PCR test, but a rapid antigen test gives you a result within 10 to 15 minutes. So that is one advantage. But the disadvantage is that you may miss out tests, or you may have false positives. Apart from this, we must examine the fact that the president is being treated by a commander of the US Navy who is essentially an osteopath. He is not an allopath. I am an allopath. Allopaths are people who have a degree which is called the MBBS or MD. The osteopaths have a different degree, but they are they are permitted to provide or administer medicines to patients, but their main approach is treating the entire body by massaging or palpating different parts of the muscles and bones. So osteopaths are a distinct kind of doctors from allopaths. But I'm sure this osteopath is being advised and that he's consulting a board of specialists for the treatment of Donald Trump. Now, the news is that Donald Trump was not on hydroxychloroquine and is currently not on hydroxychloroquine, which is remarkable because Mr. Donald Trump has been touting hydroxychloroquine for so many months. And to know that he's not on hydroxychloroquine is some relief to me, because there have been multiple randomized trials which have shown that chloroquine is really not effective in preventing or treating COVID-19. But Mr. Trump is on famotidine and vitamin D. I have already spoken about vitamin D, that there is data which is suggestive, but again, this is not randomized data. This is observational data which has shown that people who have appropriate levels of vitamin D do have lesser clinical outcomes, less severe disease, and less mortality. The last study, which has been published some days ago in the PLOS1 journal, is from the University of Tehran, Iran, in which they have taken patients of moderate and severe, moderate illness by COVID-19, and in which they have found that people who had a vitamin D level of more than 30 nanograms per mil had lesser mortality. In fact, the mortality in people who had vitamin D level which was sufficient above the age of 40 years had a mortality of 10% as opposed to a mortality of 20% in the people who had a vitamin D level of less than 30 nanograms per mil. So therefore, there is some case that can be made to administer or to give the president of the US vitamin D on a daily basis or on a weekly basis. Another big study, which was not done essentially on coronavirus, but was done on other respiratory viruses, was published 2 or 3 years back in the British Medical Journal. This was a meta-analysis of 11,000 people from 25 randomized trials, which showed that adequate levels of vitamin D prevented respiratory infections, especially in people who had low levels of vitamin D. So from that, we can extrapolate that maybe vitamin D would be helpful in preventing COVID-19 or lessening the severity of COVID-19, but I am not so sure. But there is a lot of clamor for vitamin D in the prevention and toning down the clinical effects of COVID-19. So therefore, I presume that is the reason why the commander, that is Dr. Sean Conley, is giving vitamin D to the president. Apart from this, the president is also on a acid drug which is called famotidine. Famotidine is an H2 receptor blocker, and this is used to prevent acidity in the stomach. And there is some data, again, this is not randomized, this is observational data, some is retrospective. There are 3 big papers, all 3 are from the US. One is from New York, the second one is from Connecticut, and the third is from Mississippi. The New York study has about 1,600 patients. The Connecticut study has 900 patients, and the study from Mississippi, which has been published in a journal called the Pulmonary Therapeutics and Treatment, has about 110 patients of COVID-19. These were severe patients of COVID-19, and all 3 studies have reported that the administration of famotidine in patients of severe or moderately ill COVID-19 patients, there is a reduction of intubation and there is a reduction in mortality by COVID-19. So why is famotidine used? Now, famotidine is easily available in every city of India. The drug is very cheap. It was a drug which was used for acidity and which has now largely been replaced by proton pump inhibitors such as famotidine, such as pantoprazole or Pantocid. Now, famotidine, being an H2 receptor blocker, prevents the development of inflammation and prevents the production of cytokines. Histamine is a strong producer of inflammation, strong inducer of inflammation and cytokines. So therefore, if you give a drug which prevents histamine, then you can presume or hope that the cytokine storm which develops in some patients can be prevented. And that is the reason why in this study, which was published in PLOS1, there was a reduction in intubation and mortality in patients who were given famotidine. In this study, apart from famotidine, the patients received cetirizine. Now, cetirizine is also a freely available drug in India. It is an anti-allergic drug. It is a histamine 1 receptor blocker. So, a combination of histamine receptor 1 blocker and famotidine, which is a histamine 2 receptor blocker, has prevented severe clinical symptoms, has prevented the number of patients admitted and requiring intubation, and has reduced mortality in this study, which is published from Mississippi. And apart from this, the New York study, which had 1,600 patients, also showed that only famotidine at a dose of about 40 milligrams per day did prevent intubation and reduce mortality. Now, the signal for famotidine came from China. And this was a very bright American doctor called Michael Callahan. Michael Callahan visited Wuhan in those peak days of COVID-19 in China, and after examining records of patients, found to his surprise and to the surprise of Chinese investigators that the poorer folks in China were faring better than the richer people in China. What they found out was that people above the age of 80 years, 20% were dying. But they also found out that people on famotidine fared much better than people not on famotidine, or rather on a proton pump inhibitor. The exact figures were that patients, the richer people, on a PPI, on a proton pump inhibitor, the mortality was 27%, whereas the mortality in the poorer folks was only 17%. So a rough signal was being felt that maybe famotidine, because it was an H2 receptor blocker, was preventing severity of COVID-19 in these Chinese patients. Now, the records which were examined were not of a few hundred, but of more than 6,000 patients in Wuhan. Now, the best line in this story, which was published in The Scientist, and I will provide a link, is that Michael Callahan is quoted as saying, and in fact I have said this in one of my videos long ago, and Michael Callahan says, and of course this is a quotation, I don't have the exact words, but the gist, or in fact the message is very clear, that the smartest doctors in the National Institute of Health, the US, the smartest doctors in Stanford University and in Harvard University are no match for the average doctor in Wuhan treating COVID-19, especially in the treatment of COVID-19. So the message is very clear that you may be a doctor in the West, but that does not necessarily guarantee that you give the right treatment for COVID-19. Now, let's take Donald Trump's treatment. The most important thing is that even before he was flown to the hospital by a helicopter called Marine One to Walter Reed, he had already been given 8 grams of an infusion of a cocktail of monoclonal antibodies made by Regeneron. Now, I have already mentioned this on the 27th of October in a video, that monoclonal antibodies are the next big thing in the treatment of COVID-19. This drug, or this therapeutic, is of course experimental. This has not been still published in any peer-reviewed journal. There is no randomized trial, but the Regeneron data is on 275 patients of COVID-19. Half were given usual treatment. The other half were given 2.4 grams or 8 grams of a combination of 2 monoclonal antibodies, and the result were very good. Recovery time was reduced from 13 to just 6 days in the patients who received 8 grams of the cocktail. And that is the reason why Donald Trump also received 8 grams of the combination cocktail made by Regeneron. At that study, the mean age was 45 years and half of the patients were males. And the important conclusion drawn by the researchers was that the patients who had low levels of antibodies against COVID-19 were much more vulnerable or much more well treated by the cocktail monoclonal antibodies. Now, that is the reason why Donald Trump was given this cocktail. And also the timing is very important, because you have to give the antibodies as they are antivirals, and also they can prevent the infection by COVID-19. So the timing has to be important. The timing has to be very early. And that is the reason that the cocktail was given within 1 day of the announcement of COVID-19 infection by Donald Trump. Now, this is very important for all doctors in India to bear in mind, that an antiviral has to be given early, within the 48 hours or 72 hours of symptom onset. Now, to underscore this quickness or early treatment by an antiviral, one must look at the natural history of COVID-19. The first part, as you all know, is when the virus is multiplying. So that is the viral multiplication or replication duration, which lasts for about 7 to 8 days or 9 days. And in an unfortunate few, there is a ramped up production of immunity, of antibodies, and this ramped up or hyper immune response in a few patients actually produces the much dreaded cytokine storm, which attacks the organs of the patients and which attacks the lungs, the heart, the kidneys, and the liver of the patient concerned. So the second phase of the disease is the ramped up hyperimmune response in the patient, and this is tackled by steroids or drugs which prevent this hyperimmune response. And that is the reason why the recovery trial and the meta-analysis on corticosteroids has shown that corticosteroids, when given in patients already on ventilators, reduce mortality by 30%, and when given to patients given oxygen by a BiPAP or who are given high flow oxygen, the mortality is reduced by 20%. So remember, if a person has COVID-19, it is best to give him or her an antiviral as quickly as possible, as was given to the President of the United States of America. Donald Trump received the antibodies within 48 hours or 72 hours of his symptom onset, and also they immediately began the course of remdesivir. He has already received 2 shots of remdesivir. The first dose must have been 200 milligrams, and the second would be 100 milligrams. And he, I think, is to be given the 5 days course of remdesivir. So which means that he has to be in hospital for the next 3 days, whether he likes it or not. Now, here I would add that the natural history suggests that the disease may take a bad turn after a week or 8 days. But that is the natural history. This prognosis has been derived from the earlier days of the COVID-19 pandemic. I presume, and I am hopeful, I am very, very hopeful, that because Donald Trump has received both the antibodies, the monoclonal antibodies and remdesivir, this would not happen and he would recover in the next few days. Not only would he recover, hopefully he would have a complete and full recovery to run in and go in to his election, which is very close now, which is barely 3 weeks from today. Now, we will talk about remdesivir. Remdesivir is an antiviral drug which prevents virus replication in the cells by inhibiting an enzyme called protease, which is produced by the virus. There have been 3 or 4 randomized trials on remdesivir. The first was a Chinese trial, which was actually underpowered. It had only 235 patients and which showed little efficacy with remdesivir. This was soon followed by a large study done by the parent company, Gilead. This had 1,060 patients, almost 1,100 patients with COVID-19. 25% were on a mechanical ventilator, 20% were on a BiPAP, and 40% were receiving supplemental oxygen. the researchers concluded that the administration of remdesivir in these patients reduced recovery time from 15 days to 11 days, which was significant. Not only this, even mortality showed a trend towards lowering from 12% to 7%. Now, I have already mentioned in my previous videos, no randomized trial with remdesivir has shown a significant reduction in mortality, but these trials have always shown that recovery time is reduced significantly, as has been done in this trial which I have just mentioned. There is another randomized trial which has compared 5-day course with a 10-day course with a usual treatment. That means the patients were divided into 3 groups. These were 600 patients of COVID-19. These were moderately severely ill COVID-19 patients. And what these researchers concluded was that the 5-day course was superior at 11 days as compared to placebo, but not the 10-day course. Another randomized trial has compared a 5-day course of remdesivir with a 10-day course of remdesivir and concluded that there is no difference in clinical outcomes. And this is the reason why Donald Trump will receive a 5-day course of remdesivir. So let us repeat, or let us summarize what has happened. Donald Trump has been infected with COVID-19. He is in hospital right now. There are mixed reports. The doctors are saying that he's doing very well, but there are people from White House. In fact, the chief of staff of the White House has said that there was a time when Donald Trump's oxygen was lower than normal, and he probably did receive supplemental oxygen. But the important thing to remember is that Donald Trump has been treated by 2 antivirals. One is a combination of monoclonal antibodies, and he is undergoing treatment with remdesivir. Now, purists will again question this approach because they would say that, okay, we agree with remdesivir, which has been given authorization by FDA, but the cocktails of monoclonal antibodies is yet to be vetted by the FDA. But this implies that Donald Trump has some guts. He is a courageous person. He has consented to treatment by the antibodies. Apart from Regeneron, the other company which is making these monoclonal antibodies is Eli Lilly. Eli Lilly has also presented its data to the press of 475 patients, in which only 1.6% patients who received the antibodies reached hospital, as opposed to 6% who did not get the antibodies who got admitted to hospitals. So the conclusion, or what the researchers were implying, was that patients of mild COVID-19, if given a shot of their monoclonal antibody, would not be admitted to hospital. The drug or the monoclonal antibodies are effective in combating the virus. Monoclonal antibodies, I have already mentioned, are difficult to produce and are rather expensive, but a single intravenous shot will give you synthetic antibodies, which would be effective for almost 6 to 8 weeks and would be and should be helpful in tiding over the initial crisis. And that is the reason why Donald Trump has received the Regeneron's combination of 2 monoclonal antibodies. Apart from this, of course, the function held at the Rose Garden was a super spreader, and this was done last Saturday, and this has already infected lots of people, quite a few people in fact. So therefore, despite the fact that we now can treat this disease much better than before, we must still apply some common sense. We really must avoid crowds. When confronted with a crowd or when mingling in a crowd, we must wear a mask. We must wash our hands as frequently as possible. And also, we must not touch our faces or our mouths or noses. And apart from this, we must try to stay outdoors and not go or participate in indoor functions. Of course, the Rose Garden function was an outdoor function, but if you look at the photographs, you will see that all these very important people were sitting barely 3 to 4 inches from one another. And what else do I talk about today? Because I am a bit thrilled because of the news that the little baby has come into our family. So my thoughts are in a flux. But the Donald Trump news is very important. This tells us that the mightiest man on the planet, despite the fact that he is tested not only on every day, but actually is tested maybe 2 or 3 times in a single day. Such a man can also be infected if he does not apply common sense precautions, if he is not cautious, and such a person does require treatment. And he has been flown into the hospital because of an abundance of caution, as has been expressed by his press secretary. And I think that is the reason why the treating doctor is going very aggressive, and that is the reason why he has already given 2 antivirals, 1 experimental and 1 approved by the FDA. The FDA has also authorized emergency utilization of steroids and convalescent plasma, and I am still curious as to why Donald Trump did not receive a convalescent plasma. The time is rapidly going away, because we all know that convalescent plasma must be administered within 3 days of symptom onset. Now, the other confusion is that the doctor has said, not reportedly actually, it is on tape, that the president has been infected for 72 hours, and this was corrected by the chief of staff, that the doctor has become confused, and actually what the doctor meant was 3 days. But if what the doctor has said is true, that the president has been infected for 72 hours, this means that the president was infected as early as Wednesday or maybe even Tuesday. And this implies that on Tuesday, when he was debating Joe Biden, despite the fact that he was 6 feet away, he could have infected because of the fact that he was talking a lot, and he was there for almost 90 minutes. He was shouting a lot, he was talking a lot, and was just about 6 feet away from Joe Biden. He could have theoretically infected Joe Biden, but the good news is that Biden has been tested and he has been found to be negative. I'm sure that he will be tested again, as has been Mike Spence, the Vice President of the United States of America. Mike Spence has been tested twice, and on both occasions he has been found to be negative. The message here is that if you are found to be negative on the first test, and if there is a strong suspicion that you might have been exposed to an infected person, it is best to test you again. So we wait for Joe Biden's next test result, and I hope the next test which is done on him is not a rapid antigen test, but a PCR test. So, ladies and gentlemen, though mortality is rapidly declining in COVID-19 patients because of better treatment and better awareness in doctors, we must still apply basic precautionary measures. I cannot help but repeat this ad nauseum. We must wash our hands. We must wear a mask if we think that we are infected or in close proximity to an infected person, especially if we are working in a hospital. We must avoid crowds, and we must try to stay outdoors and not to stay indoors as much as possible. Yes, famotidine, despite the fact that there is no data, there is no randomized data, could be administered. A lot of allopath doctors, the purists, will be skeptical about famotidine. We may use vitamin D, because the important thing is that vitamin D and famotidine given for a short duration of time are largely very safe, as is also convalescent plasma, which is very safe, as are also these monoclonal antibodies. They have been found to be very safe. And the recovery trial, which has been conducted by the Oxford University, has also enrolled almost 2,000 patients who would be given in a randomized manner these monoclonal antibodies made by Regeneron. So, ladies and gentlemen, I will finish on this note. Have a good Sunday and stay away from COVID-19, but please do not fear COVID-19. If in the really rare chance that you do get infected, remember that there is treatment at our disposal, treatment during the early phase, which would be an antiviral, which could be remdesivir, which could be an antibody, a monoclonal antibody, or which could be convalescent plasma. It could also be interferon. And once, if in case a cytokine storm is brewing, then one has steroids at one's disposal. Steroids are freely available in India and also are quite cheap. Thank you very much for listening to me. If you have enjoyed this talk, please do press the icon, please do subscribe, and do share this with as many people as possible, because if you watch this video, then I get the encouragement and the inspiration to plow on, to carry on, giving you these bits of information on COVID-19. Thank you very much. Goodbye. Have a good Sunday.